Hi, Miss Nikki here. Welcome to Chapter 7, the Skeletal System. We're going to go through these PowerPoints and we're going to look at the 206 bones that we have and all of the features on those bones. Hold on, here we go. So the skeletal system is mostly bone, but there is some cartilage and some ligaments. The two major divisions we need to concern ourselves with are the axial and the appendicular. So you'll see in just a moment that axial is the core or the axis, and the appendicular are the things that hang off of, so like your arms and legs. If we look at just the axial skeleton, this consists of 80 bones, and there's three major regions. There's the skull, there's the vertebral column, and then there's the thoracic cage. And these are clearly highlighted for you. You can see that the axial is everything here in the green color. Everything else that we talk about here and here is going to be the appendicular. We're going to look at the skull first, and you can see that there's two sets of bones that make up the skull. We have the cranial bones that enclose the brain. There's 8 of those, and then we have 14 facial bones that make the framework of your face. So the cranial bones here, we have parietal, ethmoid, sphenoid, temporal, occipital, and frontal. And if you want a mnemonic for that, sometimes we call it the pest of 8. So the first letter of each makes up the mnemonic, and there's 8 of them. There are 2 parietals and 2 temporals. It would be good to know that the rest of them you only have 1 of, right? So there could be a question, which cranial bones occur in pairs? That would be parietal and temporal. So the frontal bone, this is going to make up the anterior portion of the cranium. We're going to look at these supraorbital margins and supraorbital foramen. So in this figure we can see the frontal bone, and it's nice and color coded for you in the beginning, but when we look at the models in lab, they're actually going to be real bone. They're not colored, right? We have the supraorbital foramen. It's telling you supra for superior, orbital, we know the orbital cavity, that's your eye, right? And then foramen is going to mean opening or hole. So this right here is the supraorbital foramen, and the margin is right here. This is what makes up the superior portion of your orbital. That's why it's called supraorbital. Next, we need to look at the 2 parietal bones, and these are going to make up kind of the lateral aspect of the cranial vault. And we're going to see 4 sutures. We have a coronal suture, a sagittal suture, lambdoidal or lambdoid, and a squamosal or squamose suture. And it's better to show you where these are in the figure. So here's the figure from the book. You can see that this right here is the parietal bone, and there's one on the other side as well. And you can see that it articulates or joins with the frontal bone that we just spoke about. And that line where they are fused together or come together is called the coronal suture. You can see the squamose or squamosal suture. It's here. This is going to be our temporal bone that we'll talk about in just a moment. Then there's a lambdoidal suture, which is back here. And then the one that you can't see, it's coming up on a picture is the sagittal, and it's where the 2 parietal bones come together. So here's another view of our sutures, and we can see our coronal here, our squamosal here, our lambdoidal here, and then we show you a back picture or posterior view where you can see the sagittal sutures, and this is a parietal and this is a parietal. And of course, it's easy when you have a nice colored version. Well, now when we're looking at a real skull or a plastic mold of a real skull, you can see that the lines are not as readily visible, some maybe more than others. And some of the bones, they fuse right into each other, and it's hard to see exactly where one starts and stops. So you have to have a lot of hands-on. You have to look at these and make sure that you understand where these structures are located, because during the exam you're not always going to have colored pictures. The occipital bone forms the posterior part of the cranium. It articulates with the parietal, the temporal, and the sphenoid. We haven't talked about sphenoid yet, but the 2 features that we need to focus on are the foramen magnum, or the large hole, and then the occipital condyles. So again, let's make sure we know where we are. Here's our sagittal suture. These are our parietal, and here is our occipital. So this is our occipital bone. The occipital condyles are these little notches, rounded projections, and there's a better picture coming up in just a moment. So here, and this is a different view, you can see the occipital condyles a little bit better here and here. These are rounded projections. And then you can also see the foramen magnum, which is the large hole. So the occipital condyle is where the first vertebrae is going to articulate or join. And then the foramen magnum is where your brain stem is going to exit the brain. And so basically the point at which your brain now becomes your spinal cord. Now we move on to temporal bone. So there's a few features we have to look at with the temporal bone. We have to look at the zygomatic process. Zygomatic is basically your cheek, where your cheekbone would be. We're going to see the mandibular fossa. We're going to see the external acoustic medius, your ear. And then we're going to look at the mastoid and the styloid processes. Basically, these are for muscle attachment. So back to this same view, we can see the temporal bone is here, so temporal, parietal, frontal. The zygomatic process is this tiny section of the temporal bone as it leads to the zygomatic bone. We'll talk about the zygomatic bone in just a moment, but it's one of your facial bones. So a zygomatic process is leading to the zygomatic bone. Then we have the external acoustic medius. Basically, it's the area that your ear would be located. Your external ear canal will lead to this external acoustic medius. Then we have the mastoid and the styloid. So the mastoid is this rounded projection, and the styloid is the pointy projection. And we're going to see neck muscle attachment at these locations. The next features that we need to look at are the mandibular fossa. And we've already seen the occipital condyles over here, but if this is a little bit hard to view, this is an inferior view, so you're looking up from the bottom. Remember, this color was all temporal bone. And these are little grooves, and by the title it should tell you what it is. Mandibular. Your mandible is going to fit into this socket. So this fossa is a shallow basin, and your mandible is going to fit in that mandibular fossa. The next bone we have to look at is the sphenoid, and this is a complicated bone. Some people say it looks bat-shaped or wing-shaped or butterfly-shaped. The features that we have to pay attention to are the sella turcica, and I'm sure we remember the pituitary gland. We talked about the pituitary in the very beginning when we looked at the brain. It was one of the structures we had to know, and the pituitary gland sits in the sella turcica. Then we have to look at the optic canals, which are going to allow for the optic nerves to pass through this section out to the orbitals of the eye. This is a great view of the sphenoid. We had to take the skull cap off, or the clavaria, and we're looking inside. And this pink structure here, this is all of the sphenoid. This is still frontal. These are still temporal. This is still occipital. These are parietal. So every time you look at a figure in the book, go back and try to remember as much as you can from the previous slides or previous material that you viewed. Here's the sella turcica. The sella turcica is this little seat or saddle, and this is where your pituitary sits. Also, the optic canal, these, it's kind of hard to see because I marked over them. Let me erase. These tiny little holes, little foramen, those are where your optic nerve is going to go from your eye, the back of your eye, the retina of your eye, to the part of your brain that's your visual cortex, where you process all the information that's coming from your eyes. Hopefully we see now kind of a trend that anytime it's in red, it's actually a bone, and anytime it's in blue, it's actually a feature. So next we have the ethmoid. This is the deepest bone. You can only see parts of it from an anterior view. We're going to look at the features, the cribriform plate, the crista galli, and the perpendicular plate. Here's the first figure that we need to look at, and this is what the ethmoid looks like if we were to remove it from the skull. So you can see they're trying to show you in a shadowy view that it sits slightly posterior to the bridge of the nose. So this is the crista galli, this point. The cribriform plate is this area here, and this is the perpendicular plate. Here's another simplified view so we can see from an anterior view how do we view the sphenoid and the ethmoid. So this is all that you can see here and a little bit here of the sphenoid if you're looking anteriorly at the skull. The ethmoid is here in orange, and you can see the tiny little sections of the ethmoid. All of these bones are in the way. We'd have to remove those to see the entire ethmoid, which I drew the picture here. Here's yet another view of the ethmoid and the sphenoid again. So again, here's the sphenoid, here's the sella turcica, here are the optical canal or optic foramina. Here is the ethmoid again. Now remember, the ethmoid kind of had this shape, and we said the top section was the crista galli and the cribriform plate was this section here. You can actually see this if you take the skull cap off and you look down into the skull. So this ridge right here, this ridge is the crista galli, and all of this structure here is the cribriform plate. So the last thing I want to talk about are sutural bones before we move on to facial bones. These sutural, they used to call them wormian, but these tiny little bones, these islands of bone that are created within sutures. So remember, this is the lambdoidal suture, this is the sagittal suture, and you'll see sometimes these little tiny irregular shaped bones. We don't know the significance and not everyone has them, but if you see them, they're either sutural or wormian bones. So next we have facial bones. There are 14 bones that make up the face. Some are paired and some are not. So that's what these twos are next to. Each name has to do with how many bones. You can see that the mandible only has one and the vomer there's only one. And this is my mnemonic for the facial bones. Victor's not making my pet zebra laugh, right? So Victor is not making my pet zebra laugh. Whatever it takes, right? If you have a better mnemonic, feel free to use it. So we're going to look at these in more detail. First off, what is the mandible? The mandible is, there's only one of them. This is your jaw. It's the strongest, largest bone of the face. The features that we need to look at are called condylar processes, alveolar processes, and the mental foramina. Here's the figure from your book for the mandible. You can see this right here is the condylar process, and it's going to fit into the mandibular fossa. So remember, we talked about the mandibular fossa of the temporal bone. It was a little shallow kind of basin. Well, this condylar process is what articulates into the mandibular fossa. And this is where we get TMJ, temporomandibular joint. It's where the temporal bone here and the mandible here come into contact with each other or form a joint, or we'll sometimes use the word articulate. So you need to know the condylar process of the mandible. These are the alveolar process. Basically, it's the area in which the tooth is going to sit. So it's these little projections of bone around the tooth. And then the mental foramen, remember foramen means hole, and so this little opening is called the mental foramen. So next up we talk about the maxillary bones. There are two. These are fused in the middle medially to form the upper jaw and the central part of the face. So upper teeth are held. Again, we have alveolar process. This would make sense. If we have them in the mandible, we also have them in the maxilla, since it's the upper part of the jaw. We're going to look at something called the palatine process, and we're going to look at an infraorbital foramen. Here's the figure from your book, and you can see that it makes up the upper part of the jaw and the central portion of the face. Here is the infraorbital foramen. Well, it's telling you exactly where it is. Infra is inferior. Orbital is eye. Foramen means hole. So it is the hole that is inferior to the orbital cavity. Then we also have here our alveolar process, just like we do in our maxilla. Just like we do in our mandible. Here's another view, because we cannot see the palatine process from the other view. So here it is. It makes up this section, or the front part of your palate. The back part is actually another bone that we're going to talk about in just a moment. So the front section is part of your maxilla, but the back section of your roof of your mouth is made up of another bone. So usually at this point, people ask me why we have foramen, or so many foramen in the face and in these facial bones. Well, I want to point out to you this Gray's Anatomy drawing where we're going to see the artery. And remember, arteries are dropping off glucose and oxygen specifically to muscles or neurons that need to make ATP through cellular respiration. So all of these are muscles. And you can see here the mental foramen, you can see the infraorbital foramen as well. So there are lots of openings in order for blood vessels to be able to innervate that particular tissue in that area. So now we move on to the other facial bones. They're all still individual, but it's not worth putting a whole slide. So we're going to do several of these at one time. So here's the zygomatic bones. These are basically your cheekbones. Then we have nasal bones. These are going to form the ridge of your nose, or the bridge. We're also going to look at the lacrimal. We're going to look at the palatine, the other ones. So remember, the maxilla is the front part of your palate. The palatine bones make up the back part of your palate. And then we're going to look at your vomer, which helps create part of your nasal septum. So let's look at all of these other bones. Here's the nasal bone in purple. There's two of them. They fuse together to form the bridge of your nose. Here's the lacrimal, the green section here and here. Then we have our zygomatic, our cheekbones. We have our vomer, which is this bone right here. It's a little bit hard to see in this picture, but it does go all the way to the back posteriorly. But if you take your finger right now and you put it on your lip, your upper lip, right underneath your nose, and you press, don't press super hard, but press, and that'll be your vomer. You can feel your vomer at the base of your nose where your nose and your lip come together. So let's look at another figure. Make sure we understand what we're looking at. So go back. This is parietal, this is temporal, this is occipital, this is frontal, this is mandible, this is maxilla. Here's my zygomatic, here is my lacrimal, here is my nasal, and then the part in between here, that's still maxilla. Remember, the maxilla makes up the majority of your face. And then where's sphenoid? There's a little part of sphenoid we can see peeking out on the side. And yet another view. Now we can look at the difference between the maxilla and the palatine bones. So basically, if you draw a plus, maybe not quite a plus, but close enough, these are maxilla, these are palatine. You can see here, this is the vomer. So the vomer goes all the way through to the posterior section. What is this? This is sphenoid. This is temporal. This is occipital. These are parietal. This is zygomatic. Right? So make sure every time you're looking at these figures in the book that you go back and try to recall as much information as you can. Let's talk about the last facial bone, which is called the inferior nasal conchae. It's probably best if we look at the figure, but there are 3 pairs of conchae. 2 of them are located within the ethmoid. One of them is by itself. So this is a great figure from your book. Here's your inferior nasal conchae. And they're trying to show you this green bone here. Do you see how it's almost by itself? It's kind of like an island. It has a tiny little piece that's connected. These are the other. There is a superior nasal conchae and a middle nasal. So here's the superior, here's the middle, and here's the inferior. We can actually see the inferior when we look at a frontal view of the skull. You cannot see these parts of the ethmoid. You might be able to see a little section here. So I wanted to go back to this anterior view and make sure we can see this here and this here. These are the inferior nasal conchae. So now we move on to the hyoid bone. The hyoid bone is not a bone of the skull. It does not articulate or join directly with another bone. It's actually kind of a free-floating bone. So it sits right here underneath the mandible, and you're going to see muscles attached that are necessary for swallowing and speech. Now we move on to the thoracic cage. So the thoracic cage is going to involve the sternum, the ribs, and the vertebrae in the back, remember, posteriorly. So what is the thoracic cage going to do for us? It's going to protect our vital organs. What are the vital organs here? This is our heart, our lungs, right? It's going to support our shoulders, and it's going to provide attachment sites for muscles of the neck and the back and the chest and the shoulders. The sternum has three features or sections or portions or regions, however you want to describe it, but there are three sections that make up the sternum. So we're going to look at the manubrium, the body, and the xiphoid or xiphoid process. Next, we have to look at the ribs. So there are 12 pairs of ribs that form the thoracic cage. And we have different types. We have true, false, and floating that you might be familiar with, but we need to know the big anatomy words, right? So vertebrosternal, vertebrochondral, vertebral. It makes a lot of sense when we look at them, so we're going to have to just wait till we get to the figure. Okay, so we get to talk about the sternum now. You can see the sternum is made up of three separate regions. So this entire bone is the sternum. This is the xiphoid, this is the body, this is the manubrium. For the ribs, these are true ribs, but remember we're going to call them vertebrosternal. Why? They start at the vertebrae and they go around to the sternum. So 1 through 7 actually attach to the sternum, and they start at the back at the vertebrae. These false ribs, these are vertebrochondral. Do we remember that chondrocytes meant cartilage? So this one's 8, 9, and 10. Do you see how 8 piggybacks on 7? And then 9 piggybacks on 8, which piggybacks on 7. So these are actually, they start at the vertebrae, they come around, and they attach to cartilage. So that's why they're called vertebrochondral. And then these floating ribs are just called vertebral because they only start at the vertebrae. They do not come around and bind to the cartilage or to the sternum. Here's the structure of the rib. I just want you to see how the vertebrae attach to the rib. So here's the vertebrae here. Here's the rib. And there's kind of a curved section of the rib, and that's what actually attaches to the vertebrae. And then you can see the flatter end is what actually articulates to the sternum. So when you're holding a rib, we're not going to go through all the features of the rib. I just want you to be able to identify a rib. But if you see a more rounded, curved end, that's the vertebral end. And if you see a flat end, that's more of the sternal end. So all vertebrae have some general structures that we should know. So they all have a body, they all have a vertebral foramen, they all have intervertebral foramen, and they all have a spinous process. So these are the major ones. Yes, there's an arch. We can look at some of these others on the figure, but these are the ones I want to focus on. So here's our spinous process, and it sticks out on the posterior side. So these are the bumps you feel in your spine or your spinal column. Then we have the anterior section, which is rounded. This is facing towards the front. This is facing towards your organs in your thoracic or abdominal cavity. This is the vertebral foramen. This is where our spinal cord is going to travel. And then this section is the body. To look at the intervertebral foramen, we should come over here. So here's one vertebrae and another, and we said intervertebral foramen, right? So foramen means whole, inter means between, and this is between the vertebrae. So I'm not sure if you can see this tiny hole that's created right here when two vertebrae stack together, but that's the intervertebral foramen. And coming out of the intervertebral foramen, you're going to have spinal nerves. On to the vertebral column. So we have 7 cervical vertebrae, 12 thoracic, 5 lumbar, a sacrum, and a coccyx. Some people say this is when you eat breakfast, this is when you eat lunch, and dinner times, right? So the very first 2 vertebrae are a little bit special. So C1 is what we call the first cervical or vertebrae of the neck. It's called the atlas. And remember those occipital condyles? So the occipital condyles of the occipital bone articulate or join to the first vertebrae, which is called the atlas. So the first and second ones are the only ones that we give names to. And then the axis is what we call C2, or the second cervical vertebrae. It has a special feature on it called the dens that we need to look at, and then we need to look at the movement that each of these vertebrae allow. Here's a great figure to show you the atlas, which is this structure, and then the axis, which is this structure with the dens. Dens is the knob. So this part right here is the dens. So the atlas allows you to say yes. So this part goes up and down, and it pivots on the dens, so it allows you to raise and lower your head. The axis allows you to say no, because you can turn the atlas this way and shake your head yes or no. The rest of the cervical vertebrae, 3 through 7, I just want you to know they all have a transverse foramen and a bifid spinous process. So bifid, if you can see how this has two kind of points, this is a bifid spinous process. Remember, all vertebrae have a spinous process, but special to cervical vertebrae, also cervical vertebrae have transverse foramen. They have these holes. And these holes are going to allow cranial nerves, which we will talk about down the road in Unit 5. Cranial nerves will exit through these transverse foramen. And we should know our vertebral foramen in the middle. This is where our spinal cord is going to be located. So anytime you see transverse foramen or a bifid spinous process, you should know that you're looking at a cervical vertebrae. Just to recap, we're going to look at the rest of the vertebrae. We just looked at cervical. Now we're going to look at thoracic, lumbar, sacrum, and coccyx. You can see that the sacrum and the coccyx were bones that were separate that then fused. So here's the thoracic vertebrae. Remember, these would be our cervical. These are going to be thoracic. These are going to be lumbar. Then we're going to have our sacrum and our coccyx. So here's the thoracic vertebrae. What's interesting is they have kind of a down pointing slope. So you can see here, you could imagine if these spinous processes went straight out, it would be a little uncomfortable. So they have this down sloping spinous process. And sometimes people say these look like a giraffe. So you can see the horns here, and the ears, and then the nose. So some people say it looks like a giraffe. Okay, now we're on lumbar vertebrae, and you can see the lumbar here, and they're very large. Not only is the body large, but they have these very large, thick spinous processes. All of the weight from your body is bearing down on these large vertebrae, so they need to be able to withstand that force. And some people say this looks like a cow or a moose. If you want to use that as a reference, feel free. And lastly, we can see the sacrum. Here's the sacrum, here's the coccyx, and this is an anterior view. And you can see that they were separate bones that have fused together. I just wanted to point out the posterior view of the sacrum. So it's very, very bumpy. We're going to see lots of muscle attachments here. We're also going to have our hips. So we're going to see our hip bones attach here at these sacroiliac joints at some point. And then you can see lots of foramen. So once the spinal cord stops at the lumbar vertebrae, then we're going to have nerves that are going to feed through these foramina and feed into our legs or lower appendages.